What is a work improvement team, or as they're known as WITS?
Is a level 1 operational structure that is mandated with the responsibility of embedding quality into community health service delivery.
This is a team of members of around 6 to 8, and it's a multidisciplinary team.
Hi everyone, welcome to the See It Do It podcast series. See it means to see linked data, and do it means act on the data.
Let's make every contact count.
Core concepts, quality improvement.
Doing things differently.
Mentoring, support, supervision, and coaching.
Client perspective.
Data quality, digitization.
We are See It Do It. Welcome to the See It Do It podcast series. My name is Vicky Doyle. I'm a quality improvement advisor to the See It Do It program. Today, we're going to be talking about work improvement teams. That is everything you need to know about a WIT. I'm delighted to invite into the studio today our two esteemed guests. I'm going to ask them each to introduce themselves. So Anne, can you introduce yourself, please?
My name is Anne Pitu. I work with the Ministry of Health. I am a service delivery unit manager at the Division of Community Health.
And Lynette.
Thank you very much. My name is Lynette Okoth. I work for LVCT Health. I'm a senior technical advisor, community health, and part of the See It Do It program.
Okay, well, delighted to have these two very powerful, knowledgeable ladies in the studio who are going to talk to us about work improvement teams. So, Anne, my first question to you is, what is a work improvement team, or as they're known as WITS?
All right. A work improvement team is a level 1 operational structure that is mandated with the responsibility of embedding quality into community health service delivery at level 1.
And Lynette, what have we done with work improvement teams and See It Do It? Because they're kind of working at the interface, aren't they, between community and facility?
Yeah, thank you. So work improvement team, as Anne has mentioned, this is a team of members of around 6 to 8, and it's a multidisciplinary team and working in the interface between community and facility. And key to it is that they're able to identify gaps at the community level and at the facility level, so able to address both supply and demand gaps.
Right. And what kind of people are in the team? Can you give us examples of the different types of cadre people who are in those work improvement teams?
Yeah, so just as I've mentioned that there are around 6 to 8 members, it's a team that is chaired by a community health assistant who is a supervisor of a CHP, and co-chaired by a facility service provider, maybe an in-charge or a facility staff, but a facility. Then we have community health promoters, because we need to have a representation of the community. And also have basic community members, just members who are in the community. Then lastly, we also have opinion leaders as part of this. And as part of CITWI, just to mention, we also have a representation of the vulnerable populations. And probably in our CITWI context, we added an adolescent just to focus our thinking, because CITWI was talking around addressing issues about antenatal care. And we thought that this team was a very vulnerable team to just have a representation to share their context on what makes them delay to attend antenatal care, and how they can actually improve services at community level and facility.
So it's a real multidisciplinary mix of people.
Sure.
I think this is really important because they're all bringing different perspectives to the table.
Agree.
So maybe another question is, sometimes people are put into a team and they're unsure of their roles and responsibilities.
Mm-hmm.
How do we ensure that people understand their roles and they execute them well? So, Anne, do you want to have a first go at that?
Yeah. So thank you very much. There are clear TORs for the teams.
And the TOR?
The terms of reference.
Thank you.
And they undergo intensive training of a phased training of 3 phases. The first phase takes 4 days. The second phase takes 3 days. And then we have finally the Learning and Innovation Forum, whereby there's exchange of best practices and lessons learned, so that we can now mainstream the lessons within the QI system. So yes, indeed, there are clear modalities of ensuring that they work as a team.
Yeah. Maybe just to make an addition that as part of the terms of reference, what is very clear is that they're also told about their roles and responsibilities as part of the terms of reference, so that allows the teams to understand what their role is. Because again, noting that, as I earlier mentioned, that the work improvement team encompasses many people. It means that the people of different education levels, the people at different levels in the community and facility, so making them understand their roles and how they interface or how they interact in the work improvement team then is important. Yeah.
And then I think of my experience of working in quality improvement over many years. Sometimes you see these teams and then maybe one or two very active members, and then some of the others are taking it a bit easy, not doing very much. How do we really get them to work effectively together as a team?
Yeah, so probably I'll take a first go. Is that one of the ways of ensuring that this happens is that one, it's important that the teams understand their strengths and weaknesses. It's important to take them through who they are, what are they supposed to do, and probably just take them through the team dynamics, just to understand where they are coming from, what they're supposed to do, and just encourage teamwork. And above all, divide roles. Allow the chair, this co-chair, to just assign roles, and that motivates the team to actually do it as a team, so that those who are lagging behind actually come up to share. And I think another thing that has actually motivates them is the thought that there'll be a best sharing forum where people actually take advantage of sharing what they do. So probably, so that allows them to work as a team and actually deliver. Yeah.
Okay. And how can the WIT drive change in the communities that they serve? Because this is really what they're about. It's about trying to drive change in their own communities. And do you want to have a first go at this one?
Yes. WITs are indeed very, very critical in driving change in the communities that they serve. In number one, they are able to do like a situation analysis of the communities, how life is lived within those communities using data for evidence-informed decision making. They are able to have a clear baseline of indicators that they want to work on in terms of projects, quality improvement projects that touch on people's lives positively. And so indeed, we have seen massive evidence in communities where we have implemented work improvement teams of improved health outcomes within those communities, and also sustained change over a period of time, which is really encouraging.
That's what we're ultimately looking for, isn't it?
Yes.
Lynette, do you want to add anything to that?
Yeah, I think something else that is unique to this is that the WITs are coming from the same communities they're serving. And you also have the facility as part of that community where the community members are seeking service. So they give a true local context gaps because they come from that community, so they know what is happening. And that means that they're also best placed to come up with interventions or solutions because they best understand where they're coming from.
Yeah, I think that's so true. I've seen exactly the same work where I'm working in Liverpool, exactly the same thing there as well. So maybe my last question to you both, and this is a difficult one. We see external projects fund a lot of quality improvement work. When that project funding ends, how do we sustain those WIT efforts without that external funding? And I know it's not an easy one, this one. So, Anne, I'm going to ask you the difficult question.
Yeah, I think sustainability is quite key for any project. And looking inwardly at domestic financing, I think within our operational plans and strategy, it will be important to factor in some domestic financing to go into quality assurance across all levels, including the WIT level. And then secondly, I would want to mention that during team composition, it is important to identify the key stakeholders within the communities so that they can also be part of the process and, synergize. Resource mobilization is one of their key roles. And the Community Health Committee Chair, who is the Level 1 Leadership and Governance member, is very, very key to resource mobilization, local resource mobilization to sustain the change and also roll out new projects over years, of course, towards attainment of sustainable community health systems in the country.
I think that's what we ultimately want, isn't
Yeah.
it? Is serving our communities and meeting their needs in the most sustainable way possible.
Yeah, sure.
So, ladies, thank you so much for your insights, your wisdom. I would now like to ask you, what are your 3 key messages you would like to put out there? So, I will start with you, Anne.
Communities know their communities best and must be fully represented in WITS.
Yeah, and just to say that WITS are a driving force in improving quality, and they actually come as an interface between the community and the facility level. Yeah.
And our last pearl of wisdom, please.
Effective multidisciplinary teamwork leads to truly integrated WITS, and that is the way to go.
Thank you very much, ladies.
Thank you.
Let us do it now. Right now. No. Right now. Yeah. Right now. Right now. Let us do it now. Right now. No. Right now. Right now. Right now. Right now. Let us do it now. Right now. Right now. Right now. Right now. Right now. Right now, right now, right now, right now.